Welcome to the course on physical well-being during COVID-19. I am Dr. Naina Nimkar, Director of the Symbiosis School of Sports Sciences, and I will be dealing with the physical well-being during COVID and what are the exercises and what asanas you're supposed to be doing. What exactly are we going to be learning today? We are going to understand what the categories of COVID patients are, what the physical activity recommendations would be, the types of activities, the intensity, etc. And we are also going to be talking about the Johns Hopkins module of bouncing back from COVID-19. Actually, this is not only theory, it's also going to have a practical component. So before doing the practicals, I would want to discuss with you what are the impairments, what happens exactly when one gets COVID positive. So this disease, COVID-19, is caused by a virus. I think we all know about it. And what it affects most is the respiratory tract, the lungs, the sinuses, the nose, the throat, the windpipe. All these are badly affected. The second most important thing is that it spreads through person-to-person contact, and that's why this social distancing. It's very infectious. What is important is what happens to our body when we get COVID. We get very weak. All the time we feel a sense of fatigue. The most important symptom or impairment is the shortness of breath. We find difficulty in breathing. We find difficulty in walking and performing daily tasks. You know, a simple walk just to go into the restroom or the bathroom at home becomes difficult. Making a cup of tea would become difficult. So all these physical impairments naturally lead to stress. Again, we all know that we have to be isolated and things, so staying in an isolated situation, we are bound to be stressed. We also are fearful because we know about the deaths caused due to COVID. There's so much of negativity around us. So much of depression, and because of which all the more importance to exercise, to yoga, to pranayam, and so on. The next thing I'd like to discuss with you are the different categories of COVID patients. I think we all know about it, but I'll just quickly run through this. We have asymptomatic individuals who have no signs. Actually they have the COVID, but they have no signs. Then we have mild patients who have mild symptoms, especially in the lower or upper respiratory tract. Then we have patients who are moderately infected. They sometimes need hospitalization. So they could be having a lobar or a multi-lobar pneumonia with or without the need of supplemental oxygen. Or maybe they need to be referred to special doctors to treat them. And of course, the severe patients or the very severe patients who need ICU treatment. Now, it could be non-invasive or it could be invasive mechanical ventilatory support or with an acute respiratory distress syndrome. There could be a non-pulmonary involvement. So, severe patients are highly compromised. Moving on to the next category is very severe, where there is who need immunomodulatory therapy or who go into multi-organ failure or a cytokine storm. These are extremely serious patients. Don't worry, I think our doctors are doing a good job and many of them are surviving this cytokine storm. Now, we are here to learn about the importance of physical activity for COVID patients. So, regular exercise and regular physical activity at appropriate intensity levels, mind you. It's not that you just keep walking slowly. No, the intensity of your exercise is what is going to give you the results. So at the appropriate intensity level. Why? Because it helps build the immune system. It helps in building the immune system against the respiratory infections that COVID-19 causes. It increases the immunovigilance and also improves the immunity or the immune competence. which helps in the control of these pathogens. Let me tell you, there's a lot of research done in this area, and this is what has been concluded. Now, what does physical exercise do? It acts as a modulator of the immune system. Again, I'm repeating, it modulates the immune system. It strengthens the immune system, suggesting a benefit in the response to the viral communicable disease, especially this COVID. This regular practice at adequate intensity, mark my words, adequate intensity, is suggested as an auxiliary tool. It is not the only tool, it is an auxiliary tool in strengthening and preparing the immune system for COVID-19. Now, I mean, this is the basics. So, what did we understand here? We understood that the physical activity or the exercise or the pranayama or whatever we are going to be doing has to be at the right intensity. So, now coming to the physical activity recommendations. Now, what are these recommendations? Now, we will again go into the categories which we had decided, the asymptomatic, the mild, the moderate and the severe, and then decide and talk to you about what these recommendations are. And these are again based on what the World Health Organization says, what the American College of Sports Medicine says, and what of course our local government and Ayush and other bodies are also telling us. So, this is not something that is just off the hat, of course, it's based on recommendations by these top bodies. So, the asymptomatic patients, what is very important is walking, because as I told you, it affects the lungs, it affects your breathing. So, walking is the safest bet. So, walking is number one that asymptomatic patients should be doing. Of course, some asanas in which prone breathing, prone meaning where you are lying on your belly and you are breathing, is something which is absolutely required because that improves oxygen uptake. And of course, pranayama and meditation. The mild version, again here walking is important, and you could do seated or lying down asanas. Again, prone breathing is something which all categories must do even if you are in hospital, and pranayama and meditation. The moderate category, again prone breathing, asanas where you lie down, and again pranayama and meditation. And the severe and very severe, we are not recommending here because every case would be different, and therefore very important for all of us to understand that for the severe and very severe categories, the doctors are the ones who will tell you exactly what kind of activity you need to do. So, again to repeat, whatever we are going to tell you today is not for the severe or the very severe category, or those patients who are moderate and yet requiring hospitalization. Please note this. So, we are talking more about asymptomatic patients, about mild patients, and about some kind of moderate patients who are still at home. Another important factor to consider is that those patients with comorbidities like diabetes, hypertension, maybe organs, immunosuppressant, those who are on immunosuppressant drugs and so on, should strictly follow doctor's guidelines before starting any kind of practice. So, these are some points which were very, very important. To conclude these things which I just told you, what is important of course is walking, then prone breathing, asanas, pranayama, meditation, deep relaxation. Why are we emphasizing this meditation and deep relaxation? It's because of the mental stress which we just spoke about. And it is required that the stress levels go down because that will help you recover faster. Now, coming to the rehabilitation of COVID patients. So, you've already got an attack of COVID, and now when you have COVID, what are the activities that you need to do? We just discussed. But how do you rehabilitate yourself? How do you come back to normal? I'd like to make a few statements here. For example, there are different types of people. There are some who've never done exercise before. There are some who are athletes. There are some who are elite athletes. There are some people who are in the geriatric category who just go for walks every day. So, everybody would be at different levels. This is very important for you to understand.
Let us all be seated on mats or chair, whichever is comfortable for you. Keep a water bottle handy in case you require it. Now, we will be learning the subtle set of asanas and pranayama to be practiced during COVID-19. Few instructions before starting practices. Do not begin exercise if you have fever or any shortness of breath or difficulty in breathing while resting, or if you have any chest pain or palpitations or swelling in legs. Also, stop exercise immediately if you develop any of the following symptoms: dizziness, shortness of breath more than normal, chest pain, cool or clammy skin, excessive fatigue or irregular heartbeat. Seek medical help immediately for chest pain, shortness of breath and dizziness that does not resolve with rest, or if there is any change in mental status from your normal capacity. These practices can be performed while sitting on chair or while sitting on mat with or without wall support. Be very patient and gentle and also slow while performing these practices. Listening to your body is recommended while performing each and every practice. Let us now begin the practices. If you are sitting on mat, then be seated in Sukhasana, folded leg posture, or Vajrasana. Kneel and then sit back on your legs, or Dandasana, simple seated posture with legs stretched forward. Feel free to take support of wall if required. Now, keep your back straight, roll your shoulders back, bring your hands in Namaskar position for the starting prayer. Close your eyes gently and observe your breath for few rounds. Inhale and slowly exhale. Now, while inhaling, let us chant prayer to enhance the benefits of practices. Om Sahana Vavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvinavadhitamastu ma Vishavahai. Om Shanti Shanti Shanti. Observe the silence and the positive vibes created after chanting the prayer. Now gently place your hands on your knees in Gyan Mudra. Open your eyes and adopt any comfortable posture to perform loosening practices, also called Shithilikaran Vyayama. We will be showing you each practice once and later we all will perform it all together. These loosening practices help to increase microcirculation. Participants with asymptomatic category are advised to perform 5 to 9 rounds of each practices. Mild category can perform 3 to 5 rounds and moderate category can perform 1 to 2 rounds as per their comfort level. Now let us begin with neck bending practice. Few instructions for neck movements. People with neck pain can do the practice gently, especially when taking the head backwards. People with cervical spondylitis and high blood pressure may avoid these practices. Let us start with forward and backward bending of neck. Sit upright with back straight. If sitting on chair, sit at the front side of the chair. Shoulders rolled back. Place your hands on your knees comfortably, palms facing down. Exhale and while inhaling, move the head backward slowly and gently. Now, While exhaling, move the head forward and try to touch the chin to the chest. Now let us perform it all together. Inhale and take your head backwards. Exhale and bring your chest closer, bring your chin closer to your chest. Inhale and take your neck backwards. Exhale and try to touch the chin to the chest. And last one time, slowly inhale and take your head backwards. And while exhaling, bring your chin towards your chest and relax. Now let us move on to the next practice of neck movement, right and left bending of neck. Now while exhaling, bend the head slowly to the right. While inhaling, come to the center. While exhaling, bend to the left slowly. Let us do this practice all together. Inhale and bend your head slowly towards the right. Inhale and come to the center. And exhale and move to the left side slowly. Come to the center, exhale and move to the right. Inhale and come to the center. Exhale and move towards your right. And now assume the comfortable central position and relax. Next, we will perform right and left twisting of the neck. Keep the head upright. While exhaling, gently turn the head to the right. The chin should remain in line with the shoulder. While inhaling, bring the head to the center. Similarly, while exhaling, turn the head to the left. Now inhale and bring the head to the normal position. This is one round. Let us repeat 2 more rounds. Inhale and bring the head to the left. Inhale and to the center. Exhale and to the other side. Inhale and come back to the center, and last one round. Exhale and twist your head towards the right. Inhale and come back to the center, and exhale to move towards your left side. While exhaling, assume the final position and relax. Now we'll be moving on to the next practice called shoulder rotations. Few instructions before performing the practices are: please perform the practice slowly with breathing. Cardiac patients should perform with care. Avoid the practice in case of severe back pain, vertebral and disc disorders. Now let us begin. Straighten your both the arms forward. Bend the hands at the elbow and place the palms on the shoulders. Now, while inhaling, rotate your elbows backwards while opening up your chest. While exhaling, bring your elbows closer to each other. Let us repeat for 2 more rounds. Inhale and take your elbows back, and while exhaling, bring your elbows closer. Inhale and slowly backwards. While exhaling, bring your elbows closer. Similarly, let us perform in reverse order. Rotate your elbows backwards while inhaling, and while exhaling, bring your elbows closer. Let us perform this for 2 more rounds. Rotate your elbows backwards while inhaling, and while exhaling, bring your elbows closer and relax. We will now perform trunk movement. Raise both the arms up to the chest level, elbows pointing outwards and palms facing downwards. While exhaling, twist your body towards your right side and look back gently. While inhaling, come back to the center position. While exhaling, let us move and twist towards the other side. Inhale and come back to the center. Exhale and twist your body towards right. Inhale and come back to the center. Exhale and move towards your left side. Inhale and come back to the center and relax and place your hands on your knees. The participants sitting on the mat can relax in Shithila Dandasana while stretching your legs forward and resting your hands besides your body. Now we move on to the knee movements. This practice strengthens knees and hip joints. Avoid in case of acute conditions of arthritis. Also perform the practice to the extent your body allows. Let us perform the practice now. Participants sitting in Dandasana, take your legs together. Now inhale and fold the right leg at the knee and bring the leg close to the chest while keeping the back straight or supported. Now exhale and extend your knee outwards comfortably. Let us repeat the practice for 2 more times on right side. Inhale and fold your right leg and exhale and extend the leg outwards. One more time. Inhale and bring your knee closer to your chest. Exhale and extend your leg outwards. Let us perform the practice on the left side. Inhale and bring your knee closer to your chest. Exhale and extend your leg outwards. Inhale and bend your knee towards your chest. Exhale and stretch your leg outwards one more time. Inhale and fold your leg while exhaling, stretch your leg outwards. As we are done with loosening exercises, now we'll be performing asanas in seated position. For the first asana called Tadasana or palm tree pose, we will sit or assume any of the postures shown by the instructor as mentioned earlier as well with back straight. Participants on the chair, please sit at the front side of the chair, feet placed flat on the floor. Raise your arms up from the sides. Interlock the fingers and turn the palm upwards. Now inhale and raise the arms up. Make sure that the biceps are touching the ears. Now hold the postures for 2 breaths. Inhale and exhale. Inhale and exhale. Now slowly release the interlock of the fingers and bring the arms down and come back to the normal position and relax. This asana brings stability in the body, helps to clear up congestions of the spinal nerves. Next asana is Ardhakati Chakrasana or side bend. Pull the body up from the waist before and after going into the pose. Do not allow the trunk to tilt front or back. Bend laterally. Now place your right hand on the floor for the support and raise your left hand up. Stretch the hand further with inhalation. Participants sitting on chair can hold the chair for the support. Now while exhaling, bend towards your right side. Hold the posture for 2 breaths. Inhale and exhale. One more time. Deep inhale and exhale. Now while inhaling, come back to the center. Now let us place our left hand on the left side and raise your right hand upwards. Give a nice stretch to your body upwards, and while exhaling, move towards your left side. Stay here for 2 breaths. Inhale and exhale. One more time. Inhale and exhale. Now while inhaling, come back to the center. Take your arm down slowly and relax while placing your hands on your knees. This asana promotes elasticity of lateral region. Also, lateral thoracic muscles are stretched and blood supply to them increases. Now let us move on to the forward bend posture, also called Paschimottanasana or Padahastasana. Avoid the asana in case of cardiac or back problems, abdominal inflammation, hernia and ulcers, vertigo and during pregnancy. Those with vertebral and disc disorders should also avoid this practice. Let us begin the practice. Inhale and raise your arms up from the sides. As the hands become vertical to the floor, stretch your body further upwards from the waist. While exhaling, bend forward till you are comfortable. Maintain the posture for 2 breaths. Inhale and exhale. One more time. Inhale and exhale. Now gently come up while inhaling with hands stretched above the head. Exhale and slowly return to the normal position and relax. This asana helps to completely expel carbon dioxide out of your body, makes the spine flexible and improves digestion. This also prevents constipation and menstrual problems. Now we'll be moving on to the next asana called Uttana Mandukasana. Those who are having hernia and back problems should not practice this yoga pose. This asana should not be practiced even if there is pain in elbows or shoulders. Now sit in Sukhasana or at the front of the chair. Keep your back straight. Raise your right hand up and place the palm on the back side of the left shoulder. Now raise your left hand up and place the palm on the back side of the right shoulder. This will open up your chest. Now hold the posture for 2 breaths. Inhale and open up your chest. Exhale and relax. One more time. Inhale to open up and expand your chest. Exhale and relax. Now slowly remove the left arm and the right arm and place them gently on your knees and relax. This asana gives adequate stretching to the diaphragm and lung region. This facilitates breathing. This practice is effective in overcoming respiratory congestions. Now we'll be moving on to Marjari Asana or also called cat and camel pose. Please avoid the practice in case of vertigo and neck surgeries. Now sit in Sukhasana or at the front of the chair. Place your hands on knees, palms facing downwards. On inhale, roll your shoulders back and arch your spine up. Open up your chest and look up at the ceiling. Now as you exhale, round your spine and tuck your chin into your chest. Your head and shoulders should come forward and relax. Let us do this for 2 more rounds. Inhale and arch your spine to look up at the ceiling. Exhale and roll your shoulders, chest and spine outwards and tuck your chin in. One more time. Inhale and extend your spine to look upwards. Exhale and roll your shoulders and tuck your chin. And let us come back to the normal position while inhaling and relax. This asana opens up chest for better breathing. Now let us move on to prone breathing, also called Makarasana. From seated position, gently lie down on your stomach. Keep your feet wide apart, toes pointing outwards. Bend both the arms and place the right hand on the left hand at the front. Place the forehead on your hand. Keep the eyes closed and continue breathing for 5 to 10 cycles. Inhale and exhale. One more time. Inhale and exhale. Now repeat this for 7 to 8 cycles more. Now this prone breathing helps in creating more space into the lungs to expand, thereby increasing oxygenation. Prone breathing also helps our lower lobes of lungs to participate in breathing. Now let us move on to another set of asana in lying down position, which is Bhujangasana. Do not perform in case of hernia or severe abdominal issues. Avoid practice in case of elbow or any injury related to hand. Now join your legs together. Place your hands just beside the body. Keep the palms and elbows on the ground. Keep the forehead on the floor. As you inhale, slowly lift the chin and chest and come up till the navel region. Stay there comfortably for 2 breaths. Inhale and exhale. One more time. Inhale and exhale. Now while exhaling, release the posture and come back to the normal position, adopting Makarasana posture. This asana opens up chest for better breathing. Next, we move on to the set of supine asanas. So gently lie down on your back while turning to your one side with the support of your hands. Now we'll be moving on to Markatasana or spine twist posture. Bring your both the legs together, hands besides your body. Now spread your arms along the shoulders. Now fold your right leg. While inhaling, turn to the left side as much as you can. Turn your neck to the opposite side. Stay here for 1 to 2 breaths. Inhale and exhale. While exhaling, bring your leg back to the normal position and release the posture. Now fold your left leg and while inhaling, turn to the right side and turn your neck to the opposite side. Stay here for 1 to 2 breaths. Inhale and exhale. And now gently release the posture while taking your leg to the starting position. And relax. This asana increases the flexibility of spine and is also a good exercise for ribs and lungs. It is a very relaxing posture for mind along with the body. Now we'll be moving on to the wall supported leg raise or Uttan Padasana. You can find a place near a wall to take support of the wall. Now gently start raising your leg up 90 degrees one by one. Do not bend the knee or lift the lower body or buttocks from the floor. During the final position, your legs should be kept straight with toes pointed to the ceiling. Head is kept straight and eyesight to be fixed on the raised toes. Stay here for 2 breaths. Inhale and exhale. One more time. Inhale and exhale. While releasing, gently exhale slowly and lower the legs back to the final position. Relax and breathe normally. Now we'll be moving on to Shavasana. Legs go apart, hands go apart, palms facing upwards. Now relax your body. Allow your body to become soft. Let it relax into the floor. As the body relaxes, feel the whole body rising and falling with each breath. Scan the body from toes to the fingers to the crown of the head. Release each and every body part. Release all the tension from each body part. Scan your body right from your toe to your head. Stay in Shavasana for 5 to 15 minutes. Now we'll be moving on to the set of pranayamas. Let us now gently bring our awareness back to the outer world and gently turn to your one side and come up and sit in any comfortable posture like Sukhasana, Dandasana or Vajrasana. We'll start with Anulom Vilom Pranayama now, also called alternate nostril breathing. Adopt Pranav Mudra of any one hand. Close your right nostril and inhale with your left nostril. Inhale, and while exhaling, uncover your right nostril and exhale. Repeat the cycle for 2 more counts. Inhale, cover your left nostril and exhale. Again inhale and slowly and gently exhale. Repeat the cycle for 5 to 6 more rounds, and while exhaling from the left nostril we complete the cycle. Now gently place your hand on your knee. Now we'll be moving to Bhramari Pranayama. Continue sitting in Sukhasana with eyes closed. Plug your ears gently with index fingers. Inhale deeply through nose. While exhaling slowly in a controlled manner, we will be making a steady humming sound. Let us do this all together. Inhale. While exhaling, inhale. While exhaling, continue this pranayama for 5 more rounds. Now gently place your hands on your knees. Now we'll be moving on to Omkara chanting to soothe our nervous system. Sit in Sukhasana, keep your back straight and shoulders rolled back. Eyes will remain closed. Take a deep inhale and while exhaling we'll be chanting Omkara. Let us do this all together. Take a deep inhale, and while exhaling, one more time, inhale, repeat this chanting for 5 more rounds. And now we'll be proceeding towards guided meditation or deep relaxation. Now let us lie down in Shavasana gently while taking the support of your hands. Stretch your leg forward one by one. And with the help of elbows, lie down on your mat. This practice can also be performed while sitting on chair. Now, first make yourself comfortable and relax completely. With full awareness, mindfully scan your entire body from toes to the head and give gentle mental suggestion to relax each and every body part one by one. Be aware of comfort and discomfort of each part of the body parts. Now move your awareness from the tip of the toes till waist region, part by part. Totally relax the lower part of the body, and now we'll be chanting Akara. Inhale. And feel the vibrations in the lower part of your body. Now let us bring our awareness to the abdominal region. Visualize all the vital organs in your belly and chest area and move to the neck area part by part. Also include your back and both the hands. Now totally relax the middle part of the body and then chant Ukara. Let us chant Ukara all together. Inhale. Let us feel the vibrations mostly in the middle part of the body. Now let us move towards our facial region and relax our facial region. Relax your face, your cheek, your nose, your eyes and your crown of the head and also back side of the head. We'll be chanting one Makara here all together. Inhale. And relax your facial region. And now we'll be relaxing our entire body with one Omkara. Inhale. And relax your body. Now gently bring your awareness back to the outer world and connect with the world outside. Now gently move your toes and your fingers. Gently turn to your one side. With the support of your hand, come up and sit in Sukhasana with your eyes closed. Now gently rub your palms against each other and cover your eyes with your palms. Now gently open your eyes. Keep practicing yoga, pranayam and meditation for better health.
Hello everyone, my name is Wasim Khan. Today we will be learning the Johns Hopkins model of recovery and rehabilitation. As COVID-19 attacks the body and mind, our rehabilitation efforts aim to restore the whole person, helping you return to your previous quality of life. Common impairments of COVID-19 includes weakness, fatigue, and shortness of breath with activity, and difficulty with walking and performing your daily task. When you experience these physical impairments, it can lead to stress, which can negatively affect the mind. Fear and depression can both impact the health of the body. Early interventions through exercise and activity aimed to treating the whole person will play an important role in recovery process and can start at home during self-isolation. The solution to these issues is basically to start moving. Movement heals the body and is a way to restore the mind and soothing emotions. By engaging your movements that the human body is already used to, we can bring the process of recovery and healing with exercise and movements. There are 5 layers of human movement that repair and optimize the whole person's health in body and mind. The 5 layers of human movements are: breathe deep, turn on vestibular system, cross your body, build strength, gain endurance. Our movement patterns develop during childhood and throughout our lifetimes. Movement patterns depends on our body systems to work well. Exercises that strengthen the entire person will help the body to repair and recover. The exercises address the body systems which are cardiopulmonary, which includes your heart and lungs, neurovestibular, which includes your balance and coordination, musculoskeleton, which has your muscles and your joints, and mental or cognitive, which includes your brain and your thinking ability. There are a few precautions before we start these practices, such as do not begin these exercises if you have a fever, if you have shortness of breath or difficulty breathing while resting, you have chest pain or palpitation, for example, your fluttering in your heart, you have new swelling in your legs. You can stop exercising immediately if you develop any of the following symptoms. That is dizziness, shortness of breath, more than normal, chest pain, cool or clammy skin, excessive fatigue, irregular heartbeat. Seek immediate medical help for chest pain, shortness of breath, and dizziness that does not resolve with rest or any change in mental status from your normal capacity. And now we will start with the beginning phase. Now we'll start with our beginning phase, deep breath exercises. Deep breathing while on your back. Deep breathing restores lung function by using the diaphragm. Breathing through the nose strengthens the diaphragm and encourages the nervous system to operate in a mode of restoration and relaxation. So now, lie on your back slowly with the help of your hands. Bend your knees so that the bottom of your feet are resting on the floor. Place your hands on top of your stomach and wrap them around the sides of your stomach. Close your lips and place your tongue on the roof of your mouth. Breathe in through your nose and pull air down into your stomach where your hands are. Try to spread your fingers apart with your breath. Slowly exhale your breath through the nose. Inhale, expanding your fingers, and exhale while bringing your stomach down. Again, inhale slowly and exhale, bringing your stomach down. Repeat this exercise for 1 minute. We will move on to the next exercise, deep breathing while on the stomach. So lie down on your stomach and rest your head on your hands to allow room for yourself to breathe. Close your lips and place your tongue on the roof of your mouth. Breathe in through your nose and pull air down into your stomach. Try to focus on your stomach pushing into the mattress as you breathe. Slowly exhale breath through the nose, repeating deep breaths for 1 minute. Inhale and exhale. Inhale. Feel your stomach pressing against the mat and exhale. Inhale and exhale. So the next exercise is eyes nods up and down while sitting. Sit upright on the edge of your bed or in a sturdy chair. Slowly move your gaze up and down while keeping your head still. And look down slowly. Again up, slowly look upwards. Keep your neck still and now down slowly. Now in the same posture, we will do right and left side looking. Slowly move your gaze towards your left and then slowly towards your right. Again, left side and right side. Keep your neck still. Repeat this exercise for 30 seconds. In the beginning phase, we will turn on our vestibular system. This exercise is called as bed rolling. This creates a gentle rotation in the thoracic. Now, lie on your back in a comfortable position. Lie on your back in a comfortable position. Look to the right with your eyes. Rotate your head to the right and slowly roll your body to the right so that you are on your right side. Take a deliberate breath or two. Look to the left now with your eyes, rotate your head to the left and then roll your body to the left until you end up on your left side. Take a deliberate breath or two before rolling to the right again. Again, slowly turn your head to the right and rotate your body to the right side. Again to the left, first the eyes, then the head, then the body. Roll from side to side at a relaxed pace for 2 minutes. Now the next set of exercises would be turning on your vestibular system. The next exercise would be cross your body. Cross crawl touches laying down. Lay down on a firm surface and support your head if needed. Start with your arm at your side, or if able, you can start with your arms overhead. Take your right hand and touch to your left thigh. If able, try to lift your thigh to meet your right hand. And then switch hands and legs alternately. Work these touches back and forth from side to side in a comfortable pace. Continue this exercise for 1 minute. Next practice will be for strength building. It is called as yawn to smile. Sit up straight on the edge of your bed or in a sturdy chair. Reach out your arms over your head and create a big stretching yawn. Now finish the exercise by smiling for 3 seconds in 3, 2, 1 and slowly come back down. One more time, make a big stretch of your hands and make a big yawn. And in 3 seconds, come back with smile. 3, 2, 1. Repeat this exercise for 1 minute. Now come to the sitting position. Sit upright on the edge of your bed or a sturdy chair. Place your hands around the side of your stomach. With your lips closed and your tongue touching the palate of your mouth. Breathe in through your nose and pull the air down into your stomach where your hands are. Try to spread your fingers apart with your breath. Once your lungs are full, keep your lips closed and exhale while humming, making the sound. Notice how your hands lower back down. Inhale through your nose and then exhale through your nose while making the sound of humming. Again, inhale and exhale while humming. Inhale and exhale again while humming. Repeat this exercise for 1 minute. Now, let's focus on the vestibular system. The exercise is head nods, looking up and down while sitting. Sit upright on the edge of your bed or in a sturdy chair. Close your lips and place your tongue on the palate of your mouth. Inhale through your nose and look up with your eyes. Then lift your head up as far as comfortably you can. As you exhale through your nose, look down with your eyes and lower your chin towards your chest. Try to match the movement of your eyes and head to the rhythm of your breath. Slowly look down as you exhale. Try to touch your chin to your chest and slowly look up while you inhale. Repeat this exercise for 1 minute. So the next exercise is head nods, looking left and right while sitting. Sit upright on the edge of your bed or in a sturdy chair. Close your lips and place your tongue on the palate of your mouth. Look to the right with your eyes and rotate your head to the right as if you look behind your right shoulder. Now slowly look to the left with your eyes with rotating your neck towards your left side. Rotate your head as far as your neck will comfortably allow you without causing pain. Slowly look to the right and again towards your left. Again to the right, slowly. Repeat this exercise for 30 seconds. This exercise engages the core and neck muscles. The next exercise is rocking in chair while sitting. Sit upright on an edge of your bed or in a sturdy chair. Fix your gaze on an object directly in front of you and level with your eyes. Keeping your gaze fixed and your head level with the horizon, inhale and lean back with your arms extended in front of you, keeping your back straight. Exhale and lean forward towards the object, putting your hands down. Inhale as you lean back, exhale as you rock forward. You are essentially rocking back and forth while your eye stays fixed on an object straight in front of you. Repeat this exercise for 1 minute. Exhale as you come forward and inhale, keeping your back straight. The next exercise is rocking to stand. Sit upright on the edge of your bed or in a sturdy chair. Fix your gaze on an object directly in front of you and level with your eyes. Keeping your gaze fixed and your head level with the horizon, inhale and lean back in the chair with hands extended in front of you. Exhale and lean forward slowly and stand up. Now slowly, carefully sit down back again. Inhale and lean back while extending your hand. Again, exhale and lean forward and stand up. Slowly sit down and again back straight with your hands extended and then try to stand up. Repeat this exercise for 1 minute. So the next exercise would be moving to cross your body. Seated cross crawl touches. Sit upright on the edge of your bed or in a sturdy chair. Reach your arms up over your head. Take your right hand and touch to your left thigh. If able, lift your thigh up to meet your right hand. Release the touch and return to your right hand overhead. Take your left hand and touch your right thigh if able to lift your right thigh up to meet your left hand. Release the touch and return to your left hand overhead. Work these touches back and forth from side to side. Repeat this exercise for 1 minute. The next exercise is for strength building. The equipments required for this exercise is either water bottles or a small pair of dumbbells. This exercise is called breathing bicep curls. Grab 2 cans of water bottle or 1 or 2 kilo dumbbells. Sit upright on the edge of your bed or in a sturdy chair. Hold your cans or dumbbells by your sides with your elbows straight. Inhale through your nose and try to pull air down into your stomach. As you exhale through your pursed lips, curl the dumbbells up towards your shoulders. Once the dumbbells are as high as you can curl them, slowly lower the dumbbells as you inhale through your nose. Try to match your breath with the motion of your arms. Exhale as you curl up Inhale as you lower the arms down. So exhale as you curl up and inhale as you lower them down. Repeat this exercise for 1 minute. The next exercise is breathing shoulder press. Start without any weights, but if it's too easy, hold a water bottle or 2-pound dumbbells. Sit upright on the edge of your bed or in a sturdy chair. If using canes or weight, hold them level to shoulders. Close your lips and place your tongue on the palate of your mouth. Inhale through your nose and pull air down into your stomach. As you exhale through your pursed lips, press the canes straight up overhead. Once the canes are overhead, slowly lower the canes back down as you inhale through the nose. Try to match your breath with the motion of your arms. Exhale as you press up and inhale as you lower them down. Exhale as you press up and inhale as you lower them down. Repeat this exercise for 1 minute. Now we'll work on the being phase. We will turn on our vestibular system. This exercise is called rocking on hands and knees. This activates the vestibular system, restores the reflexive posture of the spine, and integrates all major moving joints of the body through coordinating rhythmic movement. Rocking also soothes the emotions and helps one enter a mode of restoration and relaxation. Now, you slowly get onto your hands and knees. This exercise can also be done on a bed. Hold your head up and fix your gaze on the horizon. Close your lips, place your tongue on the roof of your mouth and breathe through your nose. While keeping a proud chest, rock back slowly towards your feet. Rock back as far as you're comfortable. Do not drop your head or round your back. Then rock forward until your weight is back on your hands. Keep doing this exercise back and forth at a relaxed pace. Do this exercise for 2 minutes. Slowly go back on your legs, shifting your weight, and then slowly shifting the weight back on your hands. The next exercise in the vestibular system is windshield wipers. Windshield wipers are a form of rolling. They create a gentle rotation in the thoracic and the cervical spine. This motion opens the rib cage and frees up shoulder mobility. Lie on your back and place your arms perpendicular to your body. Slowly, don't rush through the movement when you're lying down on your back. Close your lips and place your tongue on the roof of your mouth and breathe through your nose. Bend your knees and pull your knees up towards your chest. Your feet will be in the air. Look at the right with your eyes and head and then rotate your legs over to the right. Try to keep your shoulder blades on the floor. Look towards the left with your eyes and your head and then rotate your legs over the left. Keep your knees pulled up towards your chest as you rotate your legs. Work this motion from side to side at a relaxed pace. Make sure your shoulder blades are always on the ground in the entire movement. Do this exercise for 1 minute. The next set of exercise in cross your body is bird dog. This coordinates opposing limbs to move together. Cross body patterns strengthen the entire nervous system and tie the body together by creating a reflexive, strong center. So now, get on your hands and on your knees. This exercise can also be done on a bed. Hold your head up and fix your gaze on the horizon. Close your lips, place your tongue on the roof of your mouth and breathe through your nose. While keeping a proud chest, lift your right arm and your left leg and apart from each other. Then lower them down together. Now lift your left arm and your right leg apart from each other. Then lower them down together. Work this back and forth from side to side at a relaxed pace. Make sure you're balancing in the entire range of motion. Do this exercise slowly for 1 minute. The next exercise is standing cross crawl touches. Stand up straight. Close your lips, place your tongue on the roof of your mouth and breathe through your nose. Now slowly try and touch your hand to your thigh, your right hand to your left thigh, extending your left hand behind your body. If able, lift your knee up and touch it with your right hand, and then lift right knee up and touch it with your left hand. Try and do it slowly. If you have the mobility, touch your right elbow to your left knee and your left elbow to your right knee. Work this slowly from side to side, touching opposite limbs together. Do this exercise for 1 minute. The next exercise is standing heel raises. Stand up straight and place your hands on a countertop for balance. Close your lips and place your tongue on the roof of your mouth. Breathe in through your nose and lift your heels off the ground. Stand on your toes. Exhale through your nose and lower your heels back down to the ground. Try to match your breath with the motion of your feet. Exhale as your heels lift and inhale as your heels lower down. If you have the balance and the ability, let go of the countertop and lift your arms overhead as you lift your heels. Yes. Again. Sorry. If you can, balance, let go of the countertop and lift your arms over your head as you lift your heels off the ground, and lower your arms as your heels come back to the ground. Slowly lower your hands, and as you come up, raise your hands. Try to match your breath with your movement. Do this exercise for 1 minute at a relaxed pace. Close your lips and place your tongue on the roof of your mouth. Breathe in through your nose and try to pull air down into your stomach. Exhale through your nose and squat down in a comfortable level. Keep your heels down and keep your knees bent and your toes as you lower down. Slowly stand back up and inhale through your nose. Squeeze your buttocks as you stand up. Try to match your breath with the motion of your squat. Exhale as you squat down and inhale as you stand up. Exhale and inhale. Repeat this exercise for 1 minute at a relaxed pace. The next exercise is wall push-ups. Stand about 3 feet away from the wall and face the wall. Place your feet shoulder width apart. Lean forward, placing your hands on the wall, shoulder width apart. Close your lips and place your tongue on the roof of your mouth. Breathe in through your nose and bending your elbows. Lower your chest towards the wall. Exhale through your nose and push your body away from the wall. Try to match your breath with the motion of your push-up. Inhale as you lower yourself and exhale as you push away from the wall. Inhale as you come close to the wall and exhale as you push away. Repeat this exercise for 1 minute. To summarize the John Hopkins model, what we have learned from this is 3 different phases. All right. Number 1 is the beginning phase, which is just before your COVID effectiveness. Number 2 is your building phase. After beginning phase come building phase. And the third one is the being phase. In these 3 phases, there are 5 layers of your body system. Number 1 is your cardiopulmonary, which involves your heart and lungs. Number 2 is your neurovestibular, which involves your balance and coordination. 3 is your mental and cognitive. 4 is your musculoskeleton, which involves your muscles and your joints. And 5th one, which is very crucial, that is your endurance. In the cardiopulmonary layer, if you have to work on the beginning phase, you have to do your deep breathing exercise. Now remember guys, you have to do deep breathing either you're sitting down, lying down on your bed, on your back, or you're into prone position. Make sure you do this exercise for 3 minutes and do not exceed the time. If you have to work on your cardiopulmonary in the beginning, in the building phase, that is your second phase, you have to do these deep breathing exercise in either sitting or standing position. Make sure you do it for 2 minutes and do not exceed the time. If you're in the third phase, which is the being phase, all right, you have to do it standing, all the activities for 1 minute and do not exceed the time. Now, when you're working on your neurovestibular, that is your balance and coordination, in the beginning phase, you would do sitting, eyes nods up and down, and bed rolling. Okay? You would not stand and do this exercise if you're doing in the beginning phase. Do this exercise for 3 minutes and do not exceed that time. Once you're in the building phase and you're working on your neurovestibular system, make sure you're doing your head nods in sitting position and your rocking chair into sitting position. Then after that, slowly progress to the rocking to stand, which we have already mentioned before. Do this exercise for 3 minutes. If you have to work your neurovestibular system in the being phase, means the third phase, you would do rocking on hands and knees and windshield wipers for 3 minutes. Now, if you have to work on your mental or your cognitive system, in the beginning phase, that is the first phase, you will do cross-crawl touches in your bed. You would not stand up and do this exercise. You would do this exercise cross-crawl only for 1 minute. Do not exceed that time, guys. I repeat, do not exceed that time. In the beginning phase, you would do seated crawl cross touches. It is the same, just as you are lying down, now you are seated. Okay? And if you're working on the being phase in your mental and cognitive system, you would do a bird dog standing cross crawl touches for 2 minutes. Okay? So we are progressing through the phases. Remember that. Now if you have to work on your muscles in your beginning phase, for example, one exercise is yawn to smile, right? So you would do it only for 1 minute. 1 minute, remember guys. Now in the building phase, you would do bicep curls either with weights, with dumbbells, or you can take water bottle or any kind of resistance in your hand. Okay? Now do it only for 2 minutes. Do not exceed that time, people. Now in the third phase, that is the being phase, you would do a standing heel raises or a mini squat with the help of a support in front of you. Do it for 3 minutes. Do not exceed that time again, guys. Now there comes to the crucial part, that is your endurance. Now make sure whenever you're doing an endurance, do it till your capacity. Do not exceed your capacity. Do not push yourself because you are just come out from COVID. Your body system is not capable of exceeding your limits. So if you're just come out of COVID, that is in your beginning phase, do cardio activity or endurance activity not more than 5 minutes. Make sure you only do it for 5 minutes at the most, even though you're feeling healthy. If you're into building phase, that is phase 2, you do it for 10 minutes. Do not exceed that 10 minutes time. For endurance activity, you can do n number of activities, just walking on the spot, jumping on the spot, forward, backward, march on the spot. Okay? That is for the building phase and the beginning phase. Now in the being phase, which is the third phase, once you feel little more healthier, on the healthier side, what you would do is basically you will walk for 30 to 45 minutes. Now we would not recommend you to do it directly 30 to 45. Gradually progress your steps towards from 10 minutes, 15, 20 and so on. Again guys, I repeat, do not exceed your limitations. If you feel tired, fatigue at any given point of time during these phases or working on these systems, we recommend you to kindly stop the activity. Now in this John Hopkins model, we have shown few repetitions and then we have asked you to do for that duration. Make sure you do it as much as your capacity. Do the repetitions. If you can't do it for 1 minute, do it for 10 seconds, 15 seconds. But yet again, we are recommending do not push yourself, guys. So, lastly, guys, we only tell you to stay active, stay fit, keep moving, and ultimately, your immunity will boost up, you will be healthy, and you will be away from all these viruses and disease that are there in the world today. Thank you so very much, guys. God bless us all.
So we just finished with a practical session. You've learned pranayam, you've learned yogasana, you've also learned prone breathing, and more importantly, meditation, yoga nidra, and the rehabilitation as suggested by the John Hopkins model. I love this word, bouncing back from COVID. So after doing all this, where we've given you the theoretical base, we've also done the practicals, I would like to conclude with certain generic recommendations. The first thing is walk. Please walk at least 5 times per week for 15 to 30 minutes. Repeating again, 5 times a week for 15 to 30 minutes each time. That doesn't mean that 150 minutes you do only in one day. Please understand that it should be spread over the week. The next important thing are the cross-body activities. It's important for you to do these cross-body activities and gradually increase the duration for them. Okay? So if you're performing for 10 minutes, 10 seconds, increase it to 30 seconds, increase it to 1 minute, increase it to 3 minutes as just told in the John Hopkins model. You must do pranayam for 5 to 20 minutes per day. You can break it up if you cannot devote so much time. So 5 to 20 minutes per day we are suggesting, and the kinds of pranayam have already been told. Then the asanas also have to be practiced for 10 to 15 minutes per day. You can again break this up twice a day. The next thing is for those people who are infected but who do not have symptoms, that means the asymptomatic ones, can continue light to moderate intensity activity as specified by the World Health Organization. Please avoid vigorous intensity activities for 4 to 6 weeks after a positive test. I'm repeating this. You may be an athlete par excellence, but you will not attempt to do intensive activity. You do not know how this COVID has affected your body. Please go slow. Listen to your body. Okay? Now, whenever you're doing these activities, if you develop symptoms such as fever, cough, or shortness of breath, you must stop your physical activity and you must reach out to your doctor or your healthcare provider. Another important point is, of course, to monitor your oxygen levels. Very, very important. I think all of us know 94 is what is the level that you should be, 95. Anything less than 95, you should take things seriously and go to your doctor. So today, again I'm emphasizing, it's very important for you to do your activities, to do them slowly and also to monitor at different levels. So friends, most importantly, please go slow. Listen to your body. The body keeps telling you something. Stop. It says stop. Listen to it. And be patient. I promise you that these exercises will keep you safe and will help you recover fast. I hope you had a nice session today. Thank you.